Understanding and addressing value from the front lines to leadership is essential to improve outcomes, enhance the patient experience, and reduce cost. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Senior Writer with AHA. Brought to you by the American Hospital Association's The Value Initiative and Physician Alliance, the Value Rounds podcast series, Working Towards Value Together, will feature leaders from the field to explore how clinicians and hospital leaders must work together to address healthcare value and affordability. Joining us today for part 3 of the podcast series is Robyn Begley, CEO of the American Organization for Nursing Leadership, AONL, and Chief Nursing Officer at the AHA. She's in conversation with Agnes Barden, Vice President of Patient and Customer Experience at Northwell Health, and Robert Rose, Chief Nursing Officer at Atrium Health's Carolinas Medical Center.
I'd like to welcome Agnes and Rob. And to get us started, please tell us a little bit about yourself and your role. And Agnes, can we start with you?
Absolutely. Thank you, Robyn. So good afternoon. Again, I'm Aggie Barden. I'm currently the Vice President in the Office of Patient Customer Experience at Northwell Health. Northwell Health is the largest private employer in New York State and spans across Long Island into Manhattan and Westchester County. We have 23 hospitals, 770-plus medical practices, a medical school, and a nursing school. In my long career, I've worked as a staff nurse and an educator in various clinical areas, specifically critical care and behavioral health. I've had the opportunity to work as a senior director in creating a new department, patient and family-centered care at one of our tertiary hospitals, Associate Executive Director for several non-clinical departments, inclusive of food services, environmental services, chaplaincy, volunteers, concierge, etc. And I joined the newly created Corporate Office for Patient Experience in 2015. I had the opportunity to present nationally and publish work on patient experience, and it is my pleasure and privilege to be here today with you on this podcast.
Thank you, Aggie. And now you, Rob?
Sure. My name is Rob Rose, and I work for Atrium Health, formerly Carolinas Healthcare System. It's a large integrated system with over 40 hospitals, 900 care locations, and 60,000 employees. In my role, I serve as the Chief Nurse Executive for our central market, which includes our Carolinas Medical Center, which is the Atrium Health's academic flagship, 900 beds, our children's hospital, and I also have a small community hospital, about 200 beds, in addition to a number of provider-based clinics and our large integrated oncology center, which is Levine's Cancer Institute.
Thank you both. So let's begin with our questions. Hospitals are continuously working towards improving value, which we define broadly to include strategies that lower cost, improve outcomes, and enhance the patient experience. How do you view value in your work, in your role? And Aggie, let's start with you.
Great, thank you. Thank you, great question, and I truly appreciate the opportunity to provide insight on this. So while my roles and responsibilities have definitely changed and shifted over the years, taking on new roles and opportunities, the one thing that's always remained is the patient and family experience has always been at the core of my focus as a healthcare professional. Whether I was working in the critical care arena, I learned the fast-paced delivery of clinical, competent, compassionate care. In my roles in behavioral health settings, I learned the importance of further developing my listening and empathy skill set. In my current role, my focus and value has been being a leader on a newly created team that had the opportunity to develop system-wide strategy to enhance patient experience across the continuum of care and to ensure that patient experience was interwoven with quality, safety, and employee engagement. Our system-wide strategic plan was tied to our system mission and core values. So at Northwell, our mission is to improve the health and quality of life for the people and communities we serve by providing world-class service and patient-centered care. And we have 3 promises. The first is our brand promise. It's to our consumers, and that's transformative leadership driving the future of healthcare, wellness, and quality of life. Our culture of care is our promise to our patients and families. And our promise is grounded in the tenets of connectedness, awareness, respect, and empathy. We have a 2-hour interactive course for all 77,000 employees at Northwell Health that receive this course. And then our employee promise is our promise to one another, built on our values of compassion, ambitiousness, innovative, together, and ourselves. So we measure value, as many health systems do, about readmissions and medical management, increase in network utilization, and reducing avoidable days and avoidable ED visits. But the one I'm going to focus in, because it's my role, is patient experience. So when we talk about star ratings, we know that healthcare organizations and leaders take the publicly reported data seriously, as it impacts reputation, revenue opportunities, and most importantly, it impacts overall quality of care. It's what's important to the patient. So star ratings require organizational and site-specific strategy plans to address each star domain. And so with the HCAHPS, we know all the different categories, from overall rating to likelihood to recommend to the nurse communication and doctor communication, responsiveness, med communication, cleanliness, quietness, discharge information, and care transitions. And we also want to tie it to hospital value-based purchasing, which really focuses on the 4 categories of person and community engagement, which is the HCAHPS survey, safety, clinical outcomes, and efficiency and cost reduction. So we know that each domain is worth 25% of the total performance score that we call the TPS. So organizationally here in New York in 2014, Michael Dowling, who's our president and CEO, appointed Sven Gerlanger as an SVP and CXO to develop a system-wide approach to patient experience. So our department was just created in 2015. And over the last 5 years, we've created our Northwell Patient Experience Strategy, which focuses on 4 components: culture, care delivery, hospitality, and accountability. And then what we've done is we've created an ecosystem around that, and we function on several different elements. The first one is all about strategy and structure. And we created a role that we call the culture leader role. There's 63 culture leaders across our organization at every site and service line that report directly to their executive director or their VP. And then we created our culture of care curriculum, as I mentioned earlier, that we have shared with 77,000 employees. In terms of culture and leadership, as another part of our ecosystem, is we had a creation of a leadership course, 4 hours to all senior leaders, followed by the culture of care course. Then another element is our education and research. And I just want to share 2 key things that I'd like to share as it relates to star ratings. One of the things that we did is we created a star ratings bundled toolkit, which highlights best practices in an effort to provide insight and guidance on enhancing the overall and domain-specific patient experience performance. In another example, when we listened to our stakeholders and patients and actually providers, we were asked by both our physicians and also by our patients to have more of an intensive focus on communication. And so we partnered with the American Academy of Communication and Healthcare and created our Northwell Relationship-Centered Communication course, which is now going into its 4th year. And following the domains in physician communication, we have seen a year-over-year improvement across the board by doing that. And now it includes all of our ACPs and also our residents as well. Additionally, we have our data and analytics team who created our analytics and support performance improvement work. And I'm proud to share with you, humbled and proud to share with you, that as an organization in 2019, Northwell Health achieved reaching our patient experience stretch target. And if you think about culture change, it was right around the 5 to 6 year mark, and that's where we began to see the culture changing and everything we developed around that to reach our goal. So I also will share with you that in 2019, an area is our patient and family engagement. And we established a key partnership with the Institute for Patient and Family Centered Care on a Better Together initiative. And we mobilized key changes in policies, education, job descriptions, website, and signage across 15 of our hospitals in 10 months. And it was just a great example of hearing the voice of our patients and families. And additionally, the last key elements of our ecosystem include innovation and technology, provider and employee engagement with a partnership with HR, and of course, quality, safety, and clinical excellence, tying them all together and tying patient experience to that. So what I would say in closing is that I've learned that every role, every person, every moment matters. And in Northwell, our patient experience definition is every moment matters. So I view my role and value as a connector to all stakeholders to ensure that we are listening to the voice of our customers across the continuum and meeting them where they are in their experience. Thank you.
Thank you, Aggie. Rob, let's turn this question to you.
Sure. So about in 2016, our newly appointed CEO, Mr. Gene Woods, started our Destination 2020, which when I was reflecting on this question, I was thinking Destination 2020, well, here we are. Who would have known what 2020 would look like today? But that included a big proponent of that was affordability. He saw where value was going, where healthcare was going, and so we looked at affordability from a couple of different lenses, not just from the economic lens, but we also looked at what does that mean to our patients from a billing perspective, from a cost of care, from how we provide a cost of care, from access, and then, of course, as my colleague Aggie said, patient experience. So we really looked at it from a broad approach and really started looking at each of those components to bring down the cost of care, at the same time making it easier for our patients to access care, as well as improve patient experience. So we did a lot with our tele platform where we were able to do televisits. We did a lot from a patient experience perspective. We standardized a lot of our rounding throughout all of our inpatient hospitals. We standardized our whiteboards, for instance. These were tactics that we use to make sure that whenever a patient entered in any of our systems, they all were treated the same way, were greeted the same way, and really to make it really a whole system. And at the same time, really looking at lowering that cost, focusing on things like length of stay, not just we also looked at labor, obviously, the things that we use for our patients, all those things we brought in and kind of collectively looked at to improve our outcomes, enhance the experience, but really lower cost of care.
So, Rob, that's a perfect segue into our next question. From the clinical perspective, how do you think value will be viewed by patients and consumers after the COVID-19 pandemic, and what do you think will change in how they want to engage our patients and our consumers with healthcare in the future?
Yeah, Robyn, that's a great question. One of the things that we definitely learned as things started shutting down, particularly when in March when COVID really hit places like Aggie's place in New York, we started doing a lot of things through telehealth and using virtual care to reach our patients because we knew that our patients still needed care. And, one of the things that I talk to my colleagues about, when you look at where we are today, we called our reentry phase COVID Safe Care, where we brought back a lot of our core businesses, patient care businesses, back to the system. One of the things that we see lagging, if you will, is our ED volume. And so what I tell my ED colleagues, for 20 years now, we've been telling patients not to come to the ED for a stubbed toe, and now they've heard us. And so I think what we're seeing now in our EDs, for example, are really high acuity patients, really sick patients. So I think from a clinical perspective, we've actually, through this pandemic, patients have learned for other ways to receive care actually that are more cost effective. So when you look at our virtual platform, it's very, very convenient. And it's cheap to access care through our virtual platform, never having to leave your house or your job or wherever you are. So I think when we look at where we're going to be going in the future, virtual health will play a big part in that. I think engaging our patients, we've always known that we've had to engage our patients in a meaningful way before COVID. I think now patient safety really comes into the forefront. So all those things that we've taught our clinical staff to do in the past are so important today. People I think, are so much more hypersensitive to just basic things like washing hands, right? Putting gloves on, things that were pretty much second nature to healthcare. Now our consumers are seeing that through a different lens with COVID, and I think how we do that and how we we have a question that we use in our patient questionnaires. Have we educated you about COVID? We want our patients to know we use a platform across our health system to communicate to our patients, and in that platform are a lot of things about COVID. So I think when we look at it from the lens of post-COVID, I think really the things that still remain before COVID are still important: quality, patient experience, and cost. I think the new thing is really, though, is that we're going to have to do a lot more, I think, explaining and teaching our consumers about COVID safe care, or said a different way, how we protect them. The other thing is when we accessing care, as I mentioned earlier in the conversation, I think through the virtual platforms, we're going to see a lot of that. So, for instance, in our system, we created a virtual hospital for COVID patients. We actually have 2 floors. One's an ambulatory type floor, and the other one, as we call it, our acute care floor. That's kept a lot of patients out of the hospital. They see a paramedic visit at their home. They monitor all of their vital signs. We have nurses that, I've heard tell me, I feel like I'm back to what I went to nursing school for. They're purely doing nursing care. So it's great that we're able to give them this service during COVID, but I think patients are going to expect this after COVID. It's not just we could wrap it up and put it away in a bag and move on and go back to the old way of doing things. I think when we look at our patients' experiences, they're going to want to see that same type of care.
Thanks, Rob. Very interesting. Aggie, anything to add to that question?
So I would say for us, being in New York and being in the epicenter of where everything was happening, what we feel is the human experience is the patient experience. And when COVID-19 hit our hospitals in such an aggressive way, our ability to do that on a human level was compromised. If we think about what happened, we had over 15,500 COVID patient admissions since the beginning of the pandemic. Families were separated from their loved ones due to changes in visitation guidelines. Our staff was covered in head-to-toe PPE, preventing the ability to smile or even have their faces shown initially. And patients and families were relying on the frontline staff to be a conduit for something as simple as holding her hand or getting any type of communication. So what we really saw more than ever was the importance of the human connection, and I don't think we'll ever take that for granted again. What we've seen is that patients also valued the hard work and sacrifice of the staff and the healthcare heroes on the front line. And the things that they've shared with us is that they wanted to be connected to their families, and they wanted clear, concise communication by providers, either to them directly or to their family members. So we have just started reinstating visitation on a limited scale, and we already see the impact it has on patients to see their loved ones. One of the things we also have done is we continue to partner with our local and system family partnership councils. In June, we had our first patient partner council meeting since the pandemic, and we had to shift everything to a WebEx because we've always done it in person. And what we shared with them is everything that happened to us during the pandemic. We got their feedback. We heard what was important to them. And we know that it's really important going forward to hear the voices of our patients and families as we think about the experience going forward. Telehealth visits, which Rob mentioned, definitely. At Northwell, we were 119 telehealth visits before COVID hit, and the number grew to 3,748 during the height of the pandemic. So a lot going forward to having that venue as somewhere that patients can use going forward. But something I want to add that's a little bit different is that we also realized the impact that COVID had on our team members from a psychological perspective, our patients and families and our staff. And so we've been involved in many of the work streams post-COVID in a recovery period, including psychological well-being, where we partnered with our behavioral health colleagues from across our system. And we've created our new Center for Traumatic Stress Resiliency and Recovery, using stress first aid response to COVID. So we think that's really been important to take care of our team members who are taking care of the patients. We also have something that we do across our system called Team Lavender, which is care for the caregiver during the acute phases, and that was done around the clock during the early days of COVID. So I think basically what I would say is this unprecedented time has allowed us to really see what's actually necessary and most effective for the overall care for patients and families. And I think we've seen we can care for patients in many different ways, as Rob also mentioned. While technology can support that, the challenge will always be to make sure that the human connection is still connected and prominent.
Thank you, Aggie. One more question for you. Actually, we have two, but I'll start with you, Aggie, first. We know that clinical leaders have been key drivers of the value conversation in the past. How do we connect that conversation with the broader change efforts in healthcare delivery, whether it's payment reform or care models? Any thoughts on that?
Yes. Thank you. So care models moving forward will need to focus on things like restructuring the way primary care is delivered, as well as our hospitals being more heavily equipped to provide effective virtualized care, digital education, and other resources. Based on our diverse geographic spread, we're always aware and very connected to the health concerns in our surrounding communities and the underserved populations, especially with what happened with COVID. So at Northwell, we have a team of industrial engineers that continuously forecast our performance against key HCAP measures that are linked to value-based purchasing reimbursement, which we talked about earlier, the STAR ratings. And the team performs root cause analysis by leveraging both quantitative and qualitative patient experience feedback and understanding how operational, behavioral, and environmental factors can drive our outcomes. We then support our teams in the field with this intelligence to help develop and deploy continuous process improvement initiatives. And we're also working closely with our digital patient experience team that we call DPX on various platforms to ensure patients are better connected and educated along their journey. I just also want to take a minute to talk a little bit something just tied to COVID a little bit in terms of in our communities, we've been engaged in providing serology testing. For example, we've opened testing centers across New York, including various community churches and other efforts to give back and protect our communities. And what we've learned so far is that now we're hiring a lead social worker for our system, and we recently have a new SVP for community and population health that will work to integrate such areas as community investment, community relations, community partnership, and our Center for Diversity and Equity of Care. And we also have had the opportunity to partner with the Patient Experience Policy Forum supported by the Beryl Institute. And that's really a broad-based, diverse coalition of patients and families and caregivers whose purpose and commitment is to advocate and shape policy at the national and local levels on issues that directly affect the patient and family experience and elevate the human experience in healthcare. So in summary, I would say between new and expanded leadership, the virtualization of care, as well as our ability to effectively engage the communities we serve in their own care and outcomes, we have the potential for creating a new level of patient loyalty that we must continue to harness, embrace, and nurture.
Thank you, Aggie. Great thoughts. And Rob, your response to these questions.
I think, Robyn, you made a great point about what payment reform. I know I mentioned in the previous question about our virtual hospital. That virtual hospital, I think we're up to over 5,600 discharges out of it with a census of about 1,200 patients. And when you think about the care that we're providing, and, I always think about right care at the right time and right place. And so when you think about the care that's being provided there and really the cost of care, it's significant less than being in a hospital. A little example of that, when we saw the rate starting to come down, we decided to close the acute care floor of the virtual hospital. And about a week later, now this isn't exactly ticks and ties, but about a week later we saw a big rise in our non-ICU admissions to the hospital. So today actually, July 6th, we are opening the acute care floor, and we're sending about 20 patients over to them as we speak. That can be taken care of in this lower cost setting. Before that, there was really no option. They were too sick to be at home by themselves, unsupported. So I would say, Robyn, to your question, is payment reform absolutely has to be on the table, and we as clinicians know that there's a better way to deliver care, there's a better place to deliver care, and the cost is significantly less. We are working with our payers because when you look at the outcomes and the volume that we've seen, I think it has reached the payer level, and they definitely want to know more about it. But I think that's where I know AHA has been advocating for, but we definitely need to see that payer reform before we can really change these models if we're going to make healthcare relevant and be able to support it.
So it's really not one without the other. That's what I'm hearing you say. Right?
Yeah, it's really not, Robyn. I mean, exactly right.
Okay. So, Rob, let's wrap this up, and you can go first. What advice do you have for your colleagues on how to think and communicate about value in healthcare?
Yeah, it was something that Aggie just said earlier that I was remiss not to bring up, and that is the behavioral health. One of the things that Atrium Health does, our mission is for all, so we provide a lot of behavioral health services to our community and beyond. And with COVID, this has certainly been exacerbated, not only with the healthcare team needing support, but also our community. And so I always say, do the right thing for your community. Everybody's community is different. Now, Atrium Health and Northwell, they have a very large community, quote unquote. We cover 3 states, Georgia, South Carolina, North Carolina. However, when you think about it, healthcare and HA has always said that it's local, and you have to take care of, your community first. So you need to look at your community needs and what needs to be done. And I'll flip the answer on this one, not always following the payment, right? But doing what's right for the patients. When you look at the value in healthcare, if they know that you're there for them, regardless of their need of their payer source, regardless of what we feel is important, if they know that we're there for them and our doors are always open, they're going to value the healthcare and they're going to value the local healthcare community. The other thing I would say is when you really look at where nursing, since we're on the phone, we're nurses, when you really look at how nurses have really been highlighted and elevated during this pandemic, the value of nursing cannot be understated. I know, Robyn, you being CEO of AONL, you know this, but really when you think about the care that can be delivered by nursing, our advanced practice providers, again, lower cost care, we need to look at that too. Who are our care providers? It doesn't always have to be a physician. We've been talking about scope of license for a long time, but when you look at these different and innovative places to deliver care, you're also bringing the care to the caregivers to the right acuity level for the patients, and that in itself will bring down the value, or I should say the cost. Not the value, the cost.
Increase the value. Absolutely.
Increase the value, yes.
Thank you, Rob. Great thoughts for you to end on. And Aggie, we're going to give you the last word. So what advice do you have for your colleagues?
Well, I'm just going to really piggyback to what Rob had said, doing what's right for the patient. I think all of us that do this work, that's why we come into this field, is do what's right for the patient and the family and where they are at that point of their patient experience journey. So what our patients value, while it may look and feel different, at its core it's still the same. It's always about that human connection and what's important to them. And the value is about respecting and delivering the compassionate, culturally sensitive, and clinical competent care. And I also want to bring up the piece about being a nurse and having watched my colleagues from across the organization and having my heart break when I would see different news clips and talking to them and being on the floors and visiting them while they were caring for the patients. I mean, what an extraordinary group of individuals, all our providers, but the nurses were there day in, day out, supporting not just the patients and the families they were taking care of, but each other. And it was something that will forever affect me and change how lucky I feel to be part of such an amazing profession. So I think I will just end by, I love that line, do what's right for the patient. keep your North Star focused on what's important to them, because we have the privilege to serve them and care for them.
Wonderful, wonderful words. Thank you so much, Aggie Barden and Rob Rose. We thank you for sharing your insights with us today, and this concludes our podcast.